Can we talk about bruxism?
Sure.
Is it something that people want? Is it a good thing or a bad thing? What is it?
Okay, bruxism essentially covers clenching and grinding of your teeth. It can be nighttime, it can also be during the daytime. Why do people brux? Some people will say increased stress, nightmares, that sort of thing might cause bruxism. I also think airway sort of sleep issues can cause bruxism, and also if your jaw is not aligned, I believe that will also cause bruxism. Okay, so if the brain is trying to protect the airway, then by bruxing, clenching, grinding your teeth is bracing the jaw and stopping the jaw falling backwards and obstructing the airway. So it's a protective reason to brux. Okay.
Is bruxism something that exhausts the body? Is it harmful to you? What does it do to your teeth?
So by bruxing, obviously it's not healthy for your teeth to be clenching or grinding at night time or during the day. You can damage your teeth. People crack teeth, they break teeth, they wear them flat. The muscles are overactive, so you're going to get fatigued muscles, and fatigued muscles, as anyone who exercises a lot knows, that you get cramp, you get pain in muscles because of the buildup of lactic acid and other chemicals in the muscles. So any bruxism is overusing those muscles, and you're going to get potentially pain. So
are we talking treatment that's very dramatic? Are we talking major surgery and all that sort of thing, or what sort of treatment is available for bruxism? What would be one of your first things to go to?
Well, so you can look at bruxism. You can either treat the symptoms, so in other words, protect the teeth, protect the airway. So that's one way of looking at bruxism. Some doctors might prescribe medication, okay, to relax the muscles, okay. So that's another way. I think you need to address the cause, so try to work out the cause. So a lot of people will be given what we call a bruxing or a grinding splint, which might be on the top or the bottom teeth, a hard plastic acrylic splint. So essentially that will protect the teeth. Okay, so you've got one lot top or bottom teeth covered, and the other teeth that grinding on the acrylic. The acrylic is softer, so that will eventually wear. However, if the bruxing is related to sleep disordered breathing, sleep apnea, snoring, etc., then sometimes that can actually make it worse, because something like a simple grinding splint is not repositioning the jaw or holding the jaw forward and protecting the airway. So when you wear this on its own, your jaw can still fall back, and that's not going to help the sleep apnea. So yeah.
So what would you put in for sleep apnea?
Good question. So if sleep apnea is a factor, or TMD is a factor other than just wanting to protect the teeth, then a mandibular advancement splint, a mandibular advancement device like this, will hold the jaw forward, so it's protecting the airway, it's opening up the airway. It can also be used to realign the jaw by depending where we put these wings. So if the bruxing is due to the jaws not fitting or being aligned, this can realign the jaws. And obviously, in terms of protecting the teeth, you're protecting top and bottom because you've got acrylic covering top and bottom.